Okay.
Okay.
Okay. Hi Lauren, I'm Ashley. I'm a student nurse at UTEP and I'm going to be doing a head-to-toe assessment on you today. Is that okay?
Yes.
Okay, I close the curtain and I do hand hygiene and then I'm just going to verify your identification. If I can have your name and date of birth, please.
Lauren Truman, August 13th, 1999.
Perfect. And then I'm just going to go ahead and check your vitals. Are you having any pain today?
No.
Okay, I'm just going to take your vitals. If I can see your wrist, please. And I'm just going to take your pulse. Okay, your pulse looks good. It's about 75 beats per minute. And now I'm just going to go ahead and take your blood pressure. So if you want to slip your arm through there. And then, is that too tight?
No, that's fine.
Okay, and then just go ahead and relax your arm. Okay. Your blood pressure looks good. It's about 120/80.
Thank you.
Okay, I'm going to inspect your head and face. Is that okay?
Yes.
First your head. Now your TMJ. Go ahead and open and close, please. One more time. And do you feel any pain?
No.
Okay, now I'm going to percuss your sinuses. Do you feel any pain in your frontal sinus?
No.
And your maxillary?
No.
Perfect. And then if you can just close your eyes, please. And tell me if you feel this.
Yes.
And what about this?
Yes.
What about this?
Yes.
Perfect. And now I'm just gonna have you blow up your cheeks and stick out your tongue, scrunch your forehead, and smile. Perfect. And now we are going to test your vision. So first we are going to palpate the glands. Do you feel any pain here?
No.
And we're going to assess your nearsighted vision. Go ahead and hold this up your right eye and read this sentence, please.
The cat jumped over the blue fence.
Perfect. And switch to your left eye.
The cat jumped over the blue fence.
Perfect. Thank you. Now we are going to assess your accommodation. So I'm going to have you stare at that painting right there. And when I let you know, you're going to stare at my finger. So stare at the painting, my finger, painting, and my finger. Perfect. And then now your visual fields. So you're going to let me know when you see my fingers.
Now.
No.
Now.
Perfect.
Now. Now.
Perfect. And now your extraocular eye movements. So you're just going to follow my finger with your eyes only. Don't move your head. Perfect. And now we're just going to assess your pupils. Perfect. And then go ahead and look at me. Okay, perfect. Okay, I'm gonna go ahead and inspect your ears. Any pain or tenderness?
No.
And we're gonna test your hearing. Just close your eyes and repeat after me.
Okay. One. Red.
Okay, now other side.
Two. Blue.
Perfect. Now we are gonna inspect your nose. Go ahead and look up and open your mouth. Stick out your tongue. Say ah.
Ah.
And say light, tight, dynamite for me.
Light, tight, dynamite.
Perfect. Now we're gonna inspect your neck. Palpating the carotids and the trachea and your thyroid. Any pain or tenderness?
No.
Okay, now we're testing your range of motion for your neck. Go ahead and look to the left and to the right and flex your neck, extend, and shrug. Perfect. And now we're gonna test your lymph nodes, your preauricular, postauricular, occipital, tonsillar, submandibular, mental, anterior cervical, posterior cervical, infraclavicular, and above your clavicle as well. And then now I'm just gonna auscultate your carotid and check for bruise. Other side. Perfect. All looks good. Is that it? Okay. Now I'm just going to check your chest. First inspecting it, everything looks symmetrical. Now I'm just going to palpate. Does anything hurt?
No.
Okay. Now percuss. Do you feel any pain or tenderness?
No.
Okay, now I'm just going to listen to your heart. We're going to start with the aortic, the pulmonic, herbs, your tricuspid, and your mitral. Perfect. And then now I'm just going to check your jugular veins. If you can just look up for me, please. Okay, other side. Not distended. And then if you can just turn over and lay down so I can inspect your abdomen. First, we're going to auscultate. So we're going to start at your right lower quadrant, right upper quadrant, left upper, and your left lower. Okay, all sounds good. Now we are going to percuss. Do you feel any pain or tenderness?
No.
Okay, now I'm just gonna go ahead and palpate. First, we're starting off light. Okay, now medium. This should feel uncomfortable, but it should not hurt. And lastly, I'm just gonna go deeper. You let me know if anything hurts.
No.
Perfect. Now I'm just gonna test your femoral pulse on both sides and your inguinal lymph nodes. Okay, all good. Okay, now I'm just going to assess your lower extremities. So first I'm just going to feel your legs, assessing the temperature, nice and warm, and no signs of edema. Okay, now I'm checking your pulses. So first your popliteal, good, tibial, and your dorsopedalis. Same thing on the other side, your popliteal, tibial and dorsopatellis. Okay, good. Now I'm just going to test your range of motion. So if you can push up against pressure, perfect, and extend your legs and flex them, good. And now if you can wiggle your ankles and then go ahead and adduct them, abduct, good. Now we're going to test your hips. Go ahead and push out, push in, good. And then abduct, adduct, good. Now I'm just going to have you close your eyes, please. And I'm going to touch the bottom of your foot. Tell me if you feel it and what it feels like.
Yes, and it's soft.
Good. Other side.
Yes, soft.
Good. And now I'm going to touch you with either 1 or 2 points. I would like you to close your eyes and tell me if it's 1 or 2.
2.
Yes. Other side.
1.
Correct. Okay, now I'm just going to examine your nervous system. So I'm going to have you close your eyes, touch your nose, and go ahead and do it with the other hand. Good. And then we're going to do rapid movements on your hips. So go ahead and put your hands out and turn them as fast as you can. Good. Now I'm going to have you place your hand out. And we're going to do one at a time. If you could just keep your eyes closed. I'm going to put an object in your hand and you're going to tell me what it is.
A coin.
Correct. Now your other hand.
A coin.
Correct. Okay. Now I'm going to write something in the palm of your hand and you tell me what you feel.
1.
Correct. Now your other hand.
H.
Correct. And now we are just going to assess the Romberg test. So I'm going to have you stand up, please. And you're going to stand still. Try not to move for 15 seconds. Keep your eyes closed. Perfect. Good job. Now I'm just going to have you stand up against the wall and go ahead and walk towards me normally. And walk back. Okay, and then now go ahead and we're going to do heel to toe. So make sure your toe touches your next foot's heel. Perfect. And good job. Was that it? Okay, Lauren, that concludes your head to toe assessment. Thank you for coming in, and all your findings were within normal limits.
Thank you.